Whelan Presley Funeral Home and Crematory have been serving Quad City families and veterans since 1889. Whelan Presley Funeral Homes are located in Rock Island, Milan, and Reynolds, and are proud supporters of WQPT. Alternatives is a proud supporter of WQPT and has been serving our community for 40 years. Alternatives provides professional guidance to maintain independence and quality of life for older adults and adults with disabilities.
Public health and public trust, and making people healthier by just looking out the window in the cities. Genesis Health System is known for the medicine that's conducted indoors, of course, but today we'll talk about the medicine that's helping patients just outside its walls. But first, a very tough end to a long distinguished career. Dr. Lewis Katz is retiring from his job as medical director at Impact Life. That's, of course, the blood center serving huge portions of Illinois, Iowa, Missouri, and Wisconsin. He'll remain in an emeritus position, of course, while also remaining medical director at the Scott County Health Department. After 2 years of the COVID pandemic, Dr. Katz's career has culminated in his ongoing effort to educate and warn the public about the greatest health crisis in this country's history. We talked with Dr. Katz from his Davenport home. You're stepping down from day-to-day activities for Impact Life, but it's an incredible time that you have seen when it comes to blood centers across America. You've seen tremendous change and more of an acceptance, but also some people who are more afraid of giving blood than ever before. What do you see as the future for the blood center?
You know, my crystal ball is so cloudy, but really all the movement, I think, is really towards using what we're responsible for more responsibly at the level of the hospital and at the bedside. So that we create a little bit larger gap between what we can produce and what gets used. To do that is such a complicated set of tasks that run all the way from clinician education to how the government finances the use of blood and blood components. It's extraordinarily complex. It's moving in that direction. It has been for not quite 20 years, but it's about stewardship, and we have to look at ourselves as a bit more than a dairy, where the stuff comes in one door and goes out the other door, and as partners at the bedside to be sure that what we're producing is used optimally. And we have a responsibility as a blood community to make our case to the people who pay for health care in the U.S. so that the value of what we do is recognized, and so that we begin to see reimbursement, not just for what gets used, but for what I've always called the insurance value of blood. What that means is having a robust supply on the shelves at all times, anticipating extremes of need, and not necessarily only looking at what got used at the bedside last week.
Well, and that just seems to be the biggest thing when it comes to blood donations, as you're saying, is that would the next big breakthrough be, the ability to store blood longer so that, because you only have a finite time, as you well know, when it comes to the donating of blood and the transfusion. And if you get rid of that somewhat, it would make your job a little bit easier.
Yeah, longer storage is a good goal. It's a great goal. But really, I see as a major difficulty is that we don't get paid until the blood is used. And if we consciously maintain inventories above usual need, the stuff that doesn't get used, the cushion that we have in anticipation of unusual needs, never gets paid for. So we have to stop looking at it as a kind of a retail thing where you get paid for what you sell. We need to be reimbursed in the blood community for the entire spectrum of benefits we bring to the system. And part of that includes excess capacity to account for excess needs. And we don't get that right now. And it doesn't matter whether a red cell is 35 days or 42 days. If the cushion that you keep on the shelf for emergencies isn't reflected in what you get paid, it's very difficult. It's very difficult to collect beyond average need.
When you think of blood donation, so many people just think of the bags of red blood, but you think of the apheresis program and the need for cancer patients and other patients to get platelets and to get plasma. Is that greater than it's ever been before because of new breakthroughs in science and treatments?
We use a tremendous amount of products, but over the last 20 years, we've also learned the circumstances under which we have transfused more than is really needed and those sorts of things. So it's really balancing the latest clinical research about the optimal way to transfuse against what we make available. And it's not always that we're using more and more and more, although we are using more platelets than we did when I was in training. It's really about optimal use and reflecting optimal use, and getting the clinicians to understand optimal use as well. It's a very arcane literature that a lot of people at the bedside, never see, and that isn't really very well taught in the crowded curriculum in medical school. So I think the biggest change in our role, evolving now and to evolve over the next 5, 10, 15 years, is our role in supporting good decision-making at the bedside.
Let me ask you about, because everything always goes back to the pandemic. When it comes to the COVID-19 pandemic and the blood supplies, blood collection, blood distribution, are things getting back to normal, whatever normal is now?
Yeah, they're more normal than they were a year and 2 years ago, but there's still a substantial impact. There's a lot of people who are reluctant to go out and engage in public as frequently and as intimately as they did in the past. So that's a problem. It's a little bit harder to get donors through the door because of that lingering aspect of the pandemic. Right now, it's summer, it's after Memorial Day, school's out, people are on vacation, and we're short of blood because of that as much as any impact of the pandemic. Certainly, for a long time during the pandemic, the amount of elective care that was happening in hospitals went down, blood use went down, but we're back in the hospitals to doing more of the usual stuff. So the need for blood is every day, and particularly during the summer, it's hard to get donors through the door.
You're going to remain medical director for the Scott County Health Department, of course. And I just remember talking to you about 2 years ago at the onset of the pandemic. And I was saying something to you about the fact that you must be dusting off binders because you've practiced emergency drills all along. I know, I'm glad you remember this. And you were going, I think we're going to rewrite this binder.
Yeah, there's a lot of lessons learned, tremendous number of lessons learned. But it was literally true then. We were all pulling out the pandemic plans that we had written in 2009 for the H1N1 threat, and starting there. And they look a lot different now than they did 2 years ago. So it's an enormous number of lessons learned at every level of society, but particularly in healthcare.
Well, and perhaps the most powerful one, sadly, that you may have learned is that a pandemic can become politicized, and also the belief in public health can be scrutinized and even ignored in ways perhaps you didn't expect?
In the environment that existed in the winter and spring of 2020, I wasn't terribly surprised by some of what happened. I think the degree was rather amazing. And I would hope that in public health, we've learned now that we can't wait until we have the level of evidence we would like to have before we aggressively go out to the public and push our points of view. Evidence evolves more slowly than we would like, but we need to very humbly talk about the best evidence that we have at the time and convince the public that we're credible. And that doesn't necessarily mean quoting a million papers to the public, but it means very carefully crafted messaging.
In so many ways, you did have it, because I still remember the press conference that you had with all the leaders of public health in Scott and Rock Island County at the very beginning with the QC COVID Coalition. And you tried to get the information out right away. Is that kind of one of your prouder moments also, is that there was this coming together of the entire medical community and public health and trying to get that message out at the beginning?
I don't know how effective it was at the end of the day, frankly, but I wouldn't say proud. It's what we're supposed to do. And it seems to me that people want to lionize other people these days for doing the right thing. And I mean, I think there are certain parts of our rule book that were pretty obvious, and communication early and often was always in the rule book. So I'm glad that we did it. The audience of those meetings turns out not to have been the audience, the entire audience, obviously. And the ability to be heard above the politics has been very frustrating.
We've also talked about pandemic and endemic, and whether or not COVID has become something that we now just live with. I sense from you that you don't believe we're at that point yet.
You can make a mathematical definition of endemic, and I don't think it helps anybody. I think that we're endemic when our response is normalized and not disruptive, right? When people can go about their business without being concerned what's going to happen if they walk into a bar or a restaurant or a grocery store. I don't think we're quite there yet, and especially if you're the elderly and immunocompromised, that we're not there yet. So we have a ways to go yet, and it's going to depend on a lot of stuff to get there. One is very clear and accepted messaging from public health about what the appropriate interventions, mitigations, behaviors are. And the other is the advancing science of vaccines that will produce sterilizing immunity. So those are probably vaccines that you sniff up your nose, that sort of thing, mucosal vaccines, and improved medical treatments in case you do get COVID, those sorts of things. Better prevention and better therapy. But as we get to the end of this year, I think we're going to be moving in that direction very quickly. I always qualify things with what if the next variant does something we didn't expect. But the virus has a limited space in which to evolve before it's not COVID anymore. And so I think encouraging vaccination and rational social distancing and stuff for now it's really the right message. There's nothing magic. And by the time we get well into the fall, I think we'll have a much better idea if we're approaching my definition of endemic, which is we live our lives without undue attention to the virus.
We were looking at vaccines being, the wonder drug, and everybody was looking forward to it. And now we've gotten to the point where, do you think that the people that are going to be vaccinated has plateaued? In some ways, you're just getting boosters to people that already believe in them?
Well, that's what the data looks like. I think that's what it is. But if you look very carefully at the national numbers, between infection and vaccination, 90%, give or take, of the population has immunologic experience with the virus. And so we're seeing that there's now a disconnect that didn't exist before between the number of infections and the number of people with bad clinical outcomes. And that reflects population-based immunity. And so the wild card now is two things: maintain population-based immunity, and that's mainly going to occur with booster vaccinations over time, and probably improve therapeutics that make the immune background maybe a little less critical. The work on what are called mucosal vaccines, that is vaccines that do what they do where the virus enters the body, in the nose and the upper airway. That progress it's coming. And that's really how we can get protection from an infection, as opposed to what we get now, which is protection from severe outcomes.
Dr. Lewis Katz, retiring health director at Impact Life, who is remaining as the Scott County Health Department's medical director. Well, welcome to July and the very heart of summer. Laura Adams says there's no need to sweat if you haven't found something to do quite yet on this weekend or next. She's got you covered so you can go out and about.
This is Out and About for July 1st through 7th. The John Deere Classic continues at TPC Deere Run through July 3rd. Red, White, and Boom returns to downtown Rock Island and Davenport on the 3rd, beginning at 5, with fireworks starting at 9:30. East Moline fireworks take place at Riverbend Park the 3rd from 6:30 to 10:30, and East Moline's Firecracker Run begins at 7:30 a.m. in downtown East Moline, followed by the East Moline 4th of July Parade at 1, while Bettendorf's 4th of July Festival kicks off on the 4th at 10 a.m. in downtown Bettendorf, with music at 7:30 at Bettendorf Park Band, and fireworks at dusk in Middle Park. Enjoy Mercado on 5th Summer Market each Friday night in downtown Moline beginning at 5, and Funktastic 5 kick off the 4th of July weekend at the Tanglewood on the 1st at 7, while Crooked Cactus Band perform at Bass Street Landing Summer Concert Series on Thursday, July 7th at 7. On stage, Dionysius Guild at Lincoln Park present the Greek tragedy Electra weekends from July 2nd to the 10th. The musical State Fair takes place at the Clinton Showboat Theater through July 17th, while the musical Annie takes the stage at Timberlake Playhouse through July 10th. And Tomfoolery on Tremont present Patty Vasquez July 2nd at 8 at Renwick Mansion. For more information, visit wqpt.org.
Thank you, Laura. There's more that goes into the healing process than we'll ever know. For years, Genesis Health System surgeon Dr. Joseph Lohmuller has believed really also in the healing power of nature. He helped spearhead the hospital's Green Roof project at the Genesis East Campus. Since 2010, a 4,600 square foot garden has grown on a third floor roof for patients to see from inside their hospital rooms. Now, as Dr. Lohmuller is ready to retire, he's helping spearhead an expansion of the Green Roof. We talked with Dr. Lohmuller from the roof at Genesis East. Tell me what is behind you. What are we looking at right now?
So this is a roof that sits over top of what is now the outpatient care center. It used to be the operating room here at Genesis before we remodeled. And this area, which you can't see, is all closed in. And the patient rooms you see behind me look out onto other patient rooms. And it's a pretty miserable spot. You can't see this from the street. You have to look at it from the sky or from one of these patient rooms above us. So this actually sits on top of the outpatient surgery unit where patients are, and then there are patient rooms all around us on every side.
And as you know, when you've got patients inside those buildings cooped up inside their rooms, they can get depressed. It's mind over matter. This is also healing for them because they get to see something positive.
It's really important. And the real catalyst for this came to me one day when I was over in one of the rooms over here, telling a patient and her family that she had an incurable cancer. And it was a rainy November day and the roof looked miserable and the room was miserable and it didn't do a thing to lift her spirits whatsoever. So at least now, although it doesn't change that message about a difficult health problem, it does give a better environment in which to hear it.
You're hoping to raise about $250,000 in order to improve this and expand it. Tell me about the fundraising effort that's going on.
The Genesis Foundation has taken on this project again after we appealed to their board of directors, and they have been very supportive. Part of the reason why we can add on a new green roof is the success of this one. And we have no end of patient and visitor compliments about the healing environment. So the foundation board took this on, and with the approval of the Genesis Health System Board, they were able to raise $125,000 of the $250,000 from the Adler Fund, which was a generous gift from the Adler family to work on capital improvement projects for which we otherwise are going to have difficult time getting the money. Then we've had a number of other very generous sponsors step in and say, this is really important for our community and we're going to support it. So we have people who've given us $5 and people have given us $25,000. And it's going to be a great thing to have in those patient rooms once we get the new set done.
And you have pointed out how this is win-win. Not only is it good for the patients, it's also good for the hospital. I mean, it's saving money and it's actually utilizing an area that would otherwise just be a blighted area.
It's really a great thing. And one of the things about our design is it's extremely low maintenance. We only have to water it because the sun beats down on it and reflects off the windows. It gets checked about once a month by the staff. They walk through and pull any weeds. It's a relatively simple thing. There's not much to do.
How is fundraising going so far as trying to get payments from people or organizations in order to pay for this expansion?
Well, we've been doing really well. We've had some very generous donors, as I mentioned. We're still probably in the range of about $40,000 to $50,000 yet of the $250,000 that we need. So anybody can donate to it. We actually break it up. Each one of these plants comes in a tray that's about 1 feet by 2 feet. And each tray is a self-contained unit. It has a watering system in it. They all lock together, and that's about $35. So we need 4,138 trays. And so far, we're up about 2/3 to 3/4 of the way there. And we just need that last bit of push. If people can help us, they're going to have a great asset in the community for their health system.
Have you found other hospitals or medical centers or other institutions actually looking at you and going, wait, we can do this too?
We're actually behind the curve on some of this. We took the idea from other people. I'm not a very creative guy, you'll know. And when I was chief medical officer and I saw what people had accomplished with their environments, with gardens and places where patients can look out onto or even sometimes go see, which is not possible here, unfortunately, then we actually stepped up and said, we can do this too. So this is not an uncommon thing.
You have talked about the fact that it all started in some ways because of a very difficult cancer diagnosis. What have you heard from patients since it's been put up? I mean, have you heard over and again, thank you for having this here, or wow, this has really helped me in so many different ways?
Absolutely. We've had the roof in place over 10 years, and it consistently still on patient satisfaction surveys gets specifically mentioned. We even have patients who unfortunately spend a lot of time in the hospital because of the nature of their illnesses, and they specifically request to be on a room that looks out on the garden. We've even had patients get wheeled into a room and they said, I'm not going in there. I'm leaving if you don't put me in the garden room. So we're trying to pay attention to those pieces of information and feedback we get to try to create the environment that's best for patients overall. So they are wholeheartedly endorsing the concept.
And not only patients, I'd assume staff and administrators as well.
Right. There's more than just the patient satisfaction. Their visitors come and it's a time of stress for them too, particularly a family member who's trying to support someone with a severe illness. We also have staff who are here day in and day out. And as you know, having a pleasant working environment makes for a much more positive person, more productive person, and someone who then is going to do a much better job in their role, be it the nurse, the environmental services people, our administrators, as well as everybody else who sees it.
If somebody wants to help out, how do they do that?
You can go to the Genesis Health System website. There's a foundation link, and you can click into that, and it will show you where to go to help support the green roof. And if you happen to be on our campus here, we have a number of poster boards around the campus, and you can scan the QR code on your phone, and it will take you right to the website for more information about the roof.
Dr. Joseph Lohmuller, Genesis Health surgeon and Green Roof Project champion. And if you want to help, go to the Genesis website for details. On the air, on the radio, on the web, on your mobile device, and streaming on your computer. Thanks for taking some time to join us as we talk about the issues on the cities.
Whelan Presley Funeral Home and Crematory have been serving Quad City families and veterans since 1889. Whelan Presley Funeral Homes are located in Rock Island, Milan, and Reynolds, and are proud supporters of WQPT. Alternatives is a proud supporter of WQPT and has been serving our community for 40 years. Alternatives provides professional guidance to maintain independence and quality of life for older adults and adults with disabilities.